Hi, my name is Caroline. I'm a nurse here at Riverside, and today I'm going to be teaching you how to care for and keep clean your feeding tube and the site around it. Keeping your feeding tube site clean is important to prevent infection and keep your feeding tube open for the next use. Before you begin, you'll want to make sure and wash your hands with soap and water for at least 20 seconds, or you can use hand sanitizer if soap and water is not available to you. The supplies you'll need to clean your feeding tube include gauze, warm water, and warm soapy water. But if you don't have gauze available, you can also use a clean, soft washcloth. You'll start by taking a piece of gauze and wetting it with the soapy water. This piece here is called the bolster. You'll lift it gently without pulling too hard and clean under the bolster, wiping away from the site, all the way around. Then you'll wet another piece of gauze with plain water and do the same motion again to rinse the area. And you'll finish by taking a dry piece of gauze to dry the site, again going gently underneath the bolster. You can apply a dressing around your feeding tube if your healthcare provider told you to do so. It's also good to do that if you're having any drainage around the site, because the gauze can help to absorb the drainage between the bolster and the skin to help prevent skin breakdown. If you need to or choose to apply a dressing to your feeding tube, you can use split gauze. The split gauze can be slid between the bolster and the skin. Make sure that it lies flat. And it should stay by itself if your bolster is snug enough to your body. You can also use tape if you choose to help hold the gauze in place. You would do that by taping at the top where the split in the gauze is. Try to avoid too much tape on your skin as it can cause skin breakdown. You may be provided with a securement device for your feeding tube that will be applied around your waist to hold the feeding tube close to your body. This is just one example of a securement device. There are many different kinds, and yours may look different than this. If you have any questions about how to use your securement device, contact your provider. Cleaning your feeding tube and the site around it is a good time to check the skin for redness, rash, swelling, drainage, or extra tissue growth. You'll also want to make sure that your feeding tube remains in the correct position. A good way to tell is by looking at the numbers on your feeding tube and where the bolster lies in relation to them. The number next to your bolster should be the same day after day. If you notice a significant change in where your bolster lies, contact your healthcare provider. Another important part of caring for your feeding tube is flushing. Flushing is important to keep the tube open in between uses and flush feedings or medications through after they've been given. Whether you have your feeding tube for feedings and medications now, or you have it for future use, flushing is an important part of keeping it clean and ready for use when you need it. Most feeding tubes have two separate ports, one for medications and one for feeding and flushing. Your feeding tube may be labeled, however, the middle port is usually larger and used for feedings and flushings, and the outside port is typically used for medications. Now I'm going to walk you through how to flush your feeding tube. The supplies you'll need include lukewarm tap water or water that is safe to drink. You don't want to use cold water because it can cause abdominal cramping when you administer it. You'll also need a large syringe, most are 60 mLs. Follow your healthcare provider's instructions on how often to flush your feeding tube and how much water to use each time. The syringe they provide you should have measurement markings on it so that you can fill your syringe appropriately. You'll start by removing the center cap of your feeding tube and then attach the empty syringe. If your feeding tube has a clamp here, you'll want to open that now. You'll then take your water and pour it into the syringe slowly. If your clamp is open, it will slowly drain in by gravity. Once the water is completely in, you can close your clamp, remove the syringe, and replace your cap. And that's all it takes to flush your feeding tube. Here at Riverside, it's important to us that you feel comfortable caring for your feeding tube and know when to reach out for help. Contact your healthcare provider if you have soreness, redness, or irritation around the site, abdominal pain or bloating during or after your feedings, nausea, constipation, or diarrhea that will not go away, a fever, or problems with your feeding tube. Seek immediate medical attention if your tube is blocked, your tube falls out, if you have pain around your site, you're bleeding from the feeding tube site, your tube is leaking, you choke or you have trouble breathing during or after a feeding. If you have any additional questions about how to care for your feeding tube or the site around it, please reach out to us. We are here for you.